Hey guys, I wanted to do a quick video. It won't take too long, but I wanted to talk a little bit about today's healthcare environment. And, a lot of times you read textbooks and such, and you kind of see information related to, what healthcare looks like in that given period. But, when I think about healthcare in general, like I looked at this article as an example, and this was from 2009, and it's got a lot of information in here because we changed, of course, in 2009 to the Affordable Care Act. But a lot of stuff has changed since then. And one thing that I really want to note is the impact that COVID had on healthcare operations. And a lot of people during the COVID pandemic, as an example, got completely out of healthcare. So we've had a really hard time, and I'm speaking from my own personal perspective here, of hiring key healthcare workers in the United States because I think so many retired during the healthcare pandemic that were really behind the eight ball. And we really didn't have enough resources before that. So I wanted to talk a little bit about those changes and the impact that it's had on healthcare organizations across the country. But this is an older article from 2009, and it really shows, the problems that we had back then are not the problems that we see today. Although there are some similarities, what I view as a big problem is post-COVID, the impact of healthcare workers and not having enough. As an example, primary care docs to see the amount of patients that we have in a community and to keep them healthy and safe. All right, I'm going to head over to another article and talk a little bit deeper about how healthcare is impacted today. Websites from the American Hospital Association is definitely not my work whatsoever, but there's a 2026 environmental scan. They do this every year just to see, from the perspective, where is healthcare at today, and how does it, of course, impact, where we're at, how we're doing across the board. So, there's a shift in healthcare delivery, and one thing that I want to mention that's really been effective over the last couple of years is a lot of healthcare organizations are starting to incorporate AI. And when I say AI, I'm not talking about robots doing your healthcare, but we do have robotic surgery that takes place, which is really interesting, but it still has, of course, a human behind kind of the wheel, as you could say. But there are robotic surgeries that take place without human interaction, just kind of by oversight, which is really interesting. I've seen that in brain surgery and some of the other programs. Um, um, Neuralink is an example, implants and things like that. But AI is really incorporated into healthcare dynamics more and more as I navigate this field, and I'm about midway through my career. But looking at charting as an example, so electronic health records, we've talked about that, but now AI helps chart for you. So we have people walking into patient rooms in primary care as an example, and having a recorder there on their phone, and they get consent to record the patient, and it charts your note for you so you don't have to do it and spend a lot of extra time. I do think that will help diminish the gap that we have in regards to needs. So maybe and potentially providers can see more patients in a shorter amount of time just due to the technology features. And I also think AI technology is going to help improve outcomes over time. The one thing that we want to shy away from, of course, is getting advice from a computer online. It's often not correct, but it can help speed up and keep things together from an electronic healthcare health operation perspective. So when you walk into the ED, it would be nice if your AI chart, your medical record, has everything listed there, kind of like it does today, and a provider, if you have an emergency, can go through it, and the AI could potentially provide a summary that's accurate. A lot of people say AI might continue to impact like reading like radiography reports and such. I've actually talked to a lot of people in the healthcare field, and they think that that could be the case, but we're still going to have a high need for techs in the field, and based on that, radiologists. But based on that, they think that we'll be able to be more productive with the time and people that we have. So, there's a lot of strain, and this talks about the strain in the healthcare networks across the board and RN turnover. There's a lot of things that play into how we can improve things. But I wanted to talk a little bit about AI and how it's incorporated into healthcare systems. But if you're interested, you can download this report. I'm happy to share this. If you're interested, the 2026 environmental scan. But there's a lot of information out in healthcare systems that really help. It's challenging what we have to face today, but at the same time we have hope for the future because there are changes that are taking place that I think will be really, really beneficial long term. You hear about all these big companies doing AI infrastructure builds and spending a lot of money. Healthcare is doing similar things too, not to the same scale, but there's hope for the future, and sometimes that takes risk. And I think there are some good things that are going to come out of even the shortage that we have today. I think if we can use technology in a positive way, things will get better. But I just want to give my perspective. I do this every year during this module of where we're at in healthcare today. I hope you enjoyed it, and I'll provide this link for you guys so you can access it in the course. I appreciate all the work, and let me know if you need anything. Thanks so much.